book offers a number of advantages. First of all, it brings together the most up-to-date, relevant data in a way that is easily understood, both by doctors and patients. There are some cancers that are very aggressive and always deadly, others that are indolent and would never cause any harm at all, even though they're still cancer, and then others that are in between. And so one of the ways that we found that it's helpful to talk about this and help people understand these different categories of cancer is to use this analogy of turtles, bears, and grenades. A bear is a type of cancer that most people imagine when they think of cancer. It starts small. As it grows and develops, it can become problematic, it can cause harm, become very aggressive, and eventually lead to death. However, if we catch one of these bear cancers early, before it's had the opportunity to grow in that way, it's much more easily treated, and the outcome for the patient is completely successful because we got it before it did them any harm. This is the reason, of course, that we do cancer screening, to find these bear-type cancers, get them early, and get better outcomes for our patients. Challenges arise when the cancer behaves differently than a bear-type cancer. So the grenades, like I said, those are very aggressive. A good example would be cancer of the pancreas. Usually by the time a person is diagnosed with that cancer, there's very little that we can do. We do have some treatments, they're rarely successful, and people's life expectancy after a diagnosis of pancreatic cancer is very short. On the other hand, at the other end of the spectrum, and very importantly when it comes to cancer screening, are the turtle-type cancers. These look like cancer under the microscope, but they don't behave like the other cancers. They never lead to symptoms. They would never cause death. So here's the problem we can get into if we do too much screening. If we find a lot of these turtle-type cancers, we take a healthy person, we convert them into a cancer patient, we put them through treatments that could never possibly benefit them because the cancer never put them at risk, and yet they have to endure all the harms and difficulties associated with cancer treatment. Within the book, we have an introductory section that talks a little bit about cancer screening in general. It includes a little bit about the heterogeneity of cancer, using this turtles, bears, and grenades analogy. It includes a primer on shared decision-making to help clinicians learn that approach. And then really the heart of the book is individual chapters on the different types of cancer screening.